So the topic is stages of human life and the definition of the terms phylogeny, ontogeny, trimester and viability. So first we'll start with the competency stages of human life. Prenatal development. First, fertilization is the beginning of fetal development. Then first trimester, that is from fertilization to 12th week. It is a period of embryogenesis. Second trimester, from 4th to 6th month. In this, there is rapid growth of length of the fetus. Then third trimester, that is from 7th month to birth. Rapid growth occurs in weight and organ maturation. And birth. So prenatal development ends with birth. Postnatal development. So there are many stages in postnatal development. First it is neonatal period. That is from birth to 28 days. Rapid postnatal growth and maturation occurs. Infancy, second stage. Second month to end of lactation, or usually 36 months. Deciduous tooth eruption and development milestones of recognition occurs. Then childhood, that is from 3 to 6.9 years. In this there is eruption of first permanent molar and incisors and virtual completion of brain growth. Then adolescence. The stage of lasts for 5 to 10 years after the onset of puberty. There is growth spurt in height and weight and permanent tooth eruption almost complete. Development of secondary sexual characteristics. Socio-sexual maturation. Then intensification of interest in the practice of adult social, economic and sexual activities. Adulthood. It is a transitory type and prime one. From 18 to 20 years of age for women up to 45 years. That is the end of childbearing. From 21 years to 25 years age for men to about 55 years of age. Loss of fecundity and menopause for women by age 50. Fecundity for men may decline with age but does not drop to zero at any age. Then old age and senescence. From the end of childbearing years to death. Decline in the function and repairability of many body tissues or systems. And the last postnatal stage is death. Then we go to define the terms, the competency, that is phylogeny, ontogeny, trimester and viability. So first we'll start with phylogeny and ontogeny. More than a billion years was required for evolution and its relative stability and dynamics in the relations between individual development, that is ontogeny, and evolution of species, that is phylogeny. The phenomena of ontogeny and phylogeny are close. Without ontogeny, there would not be phylogeny. Ontogeny would exhaust due to inbreeding without phylogeny. Ontogeny is initial material for phylogeny. Phylogeny renews ontogeny, leading it away from inbreeding. The main result of phylogeny is phylogenic divergence or adaptive radiation. Ontogeny is governed by morphogenic factors, whereas the phylogeny is governed by epigenic one. The objective of ontogeny is reproduction, that is propagation, and the objective of phylogeny is establishment of biodiversity by adaptive radiation. Then we go to define the term trimester. For medical abortion, accurate evaluation of early pregnancy is important to achieve highest efficacy and to avoid complications. Ultrasound and last menstrual period. Ultrasound is commonly used for pregnancy dating before medical abortion. The date of last menstrual period alone does not appear to lead to an accurate diagnosis of gestational age. Human chorionic gonadotropin levels alone are not ideal for evaluation of gestational duration because they are highly variable in first trimester, especially after 42 days. Then beta HCG levels have a high sensitivity of 95% and specificity of 62% for detecting gestations less than 7 weeks and gestations of less than 6 weeks. Prostaglandins in the past decade, early pregnancy termination using prostaglandins in combination with mifepristone has become an option for many women around the world. Misoprostol is the most commonly used prostaglandin. So many regulatory agencies and clinicians choose to limit medical abortion to 7 or 8 weeks of gestation, owing to increased side effects and failures with advancing gestational duration. Viability. In the year 1973, the Supreme Court legalized abortion in the United States. The Supreme Court decision made viability the delineating line balancing the right of pregnant person to end a pregnancy and the interests of the state. With the point of viability, states may restrict access to abortion as long as they provide an exception to the health and life of a pregnant person. The Supreme Court has defined viability in the context of abortion as when in the judgment of the attending physician on the particular facts of the case before him, there is a reasonable likelihood of the fetus sustained survival outside womb with or without artificial support. That is viability. Both the law and medical science, viability is not defined as occurring at a specific gestational age in pregnancy. A recent study of survival of extremely premature infants found that even with intervention, no infants born at less than 22 weeks of gestation survive. Thank you.